Hello, everybody, and welcome to this webinar. My name is Christopher Bosen. I work at the Improvement Service. My job here is I'm project managing the community planning support website that you may know of, but otherwise you can find more about it on the cpsupport.scot. Today we are hosting one of our webinars. We started a webinar series, and today we have Aidan McCrory. Am I saying this correctly?
Aidan McCrory.
McCrory.
Yeah.
I'll try and say that. Who is a senior improvement advisor at the Care Inspectorate's improvement support team. He's going to introduce their improvement methodology used, I believe, supporting improvement, it says. The webinar is scheduled for an hour. The presentation is going to be shorter. But after Aidan's presentation, there is a Q&A time. So if you have any questions at that time or questions during the webinar that you would like answered at the end, please feel free to use the chat function. You will find that on the right-hand side at the bottom of your panel. If you have any technical issues, you can also use that. They will go directly to me, and I can answer some of them if necessary during the presentation. We are going to record the webinar. We are recording the webinar, and we are sharing it in the CP Support Knowledge Hub group afterwards. We will also be sharing the slides, I believe. Is that okay? And if you have any questions at a later time, you're welcome to ask them in there, and I can ask Aidan to answer them for you. But I'll hand over to you right away.
Thanks very much, Christopher. Good afternoon, everybody. Like Christopher says, my name is Aidan McCrory. I'm a Senior Improvement Advisor in the Improvement Support Team in the Care Inspectorate. And we're going to spend a bit of time today just kind of running through who we are as a team, what we do, and I guess for you guys, what support we can offer around improvement. So this is a slide that I like to start off with, but it kind of frames it quite nicely. Whenever we're trying to make improvements in our services, or delivery of services, or improvement in outcomes, or even improvement in our processes, we can find that it is sometimes very difficult to get traction. You can see here that we'll have two gentlemen trying to make their way to market, and there's somebody there with some improvement support around the circular wheels, but the two guys are finding it very difficult to recognize improvement when it's right in front of them. And that's something that we can find, quite broadly speaking, that we can find that it's difficult for us out there to try and make improvements due to the complexity and busyness of everyday life. To just tell you a little bit more about myself, here you can see me and my son Dexter. I have been in health and social care for over 10 years. It's always easier just to say over 10 years rather than to get into the specifics. It kind of gives away the length of service and length of time I've actually been in the trenches for. I also have a master's in public administration, and I'm a Scottish improvement leader as well. That's the accredited course for improvement advisors. And a little bit more about myself. I've been in service where I have been delivering services. I have inspected services through my time at Healthcare Improvement Scotland, and I have been an improvement advisor helping to improve services and outcomes for people as well. So I have quite a broad range of skills and understanding about how to make improvements out there for people. So just telling you a little bit about the Care Inspectorate and the Care Inspectorate's approach. We have traditionally been a compliance model for improvement when we're talking about scrutiny, but up until around the last 5 years, we have moved more to a collaborative approach around that, where we're supporting people to make improvements and using the full breadth of our resources in terms of our staff and the improvement support team. There's obviously a new focus on outcomes, taking into consideration the health and social care standards. And we as an organisation have a key role in scrutiny, but also in supporting services to improve. And that kind of forms part of our mantra where support and improvement is absolutely everybody's business, regardless of where we are, whether in service and management roles or we are in support services. I mean, we think about this through our inspection, our improvement support, and also service delivery. And if you think about that old saying, if you always do what you've always done, you will always get what you've always got. And that brings us back to that first slide with the gentleman being too busy to improve. We need to be brave and we need to try and make room for this in our operations in order to take that next step in order to improve outcomes. I'd like to draw your attention again to our improvement strategy. This is our organizational improvement strategy, which was launched in 2007, and it runs for 2 years. This is our first improvement strategy from the Care Inspectorate, and it's quite a seminal one because it identifies key areas of work where we as an organization will that we will be participating in order to support services to improve. I mean, some of the key elements are here around our workforce development, and we'll talk a bit about that in a minute. Supporting improvements out there with services and partnerships, IJBs, and provider organisations. We in the Care Inspectorate collect significant amounts of information or intelligence that we can and should use help us to direct the level of support that we can. If you think about the complaints information, the registration information, the scrutiny activity around requirements and recommendations, the strategic inspections that you may be familiar with that we do in partnership with Healthcare Improvement Scotland, absolutely rafts and rafts of information and we are aiming to use that in a way to support services with the things that are trending or becoming more and more prevalent across the country. And of course, as a result of any improvements that we participate in and any support that we deliver or any good news stories that we find out there, it's absolutely part of our role to share that widely. We've often been subject to working in isolation. We see pockets of good practice. As a national organisation, we should be identifying where this good practice takes place and sharing that out there so others can benefit from that. We do not want to be reinventing the wheel when we see that things are going well. We also want to be continuing to build improvement alliances. My team have been working with provider organisations, like I say, health and social care partnerships, working in partnership with Scottish Care Integrated Joint Leads, and various other organisations, including HIS and NES, in order to kind of participate in this national approach to supporting services and partnerships to improve. So if you feel you want to read more about our strategy, you can find that online, and I'll leave the email address before we go today. I guess another thing worth pointing out around the strategy is that it runs to 2019, which is very swiftly going to be upon us, and we're currently focusing on the next strategy, which will be a 3-year strategy, which really will be the next steps for what we as an organisation will be doing to support improvement. So let me tell you a little bit about the improvement support team. We're a relatively new team. I think we've been in existence for just over 2 years now, but we are quite small and we do work nationally, and that's definitely worth pointing out in terms of what level of support we can offer. We can offer support at strategic or provider level. We can't get into minutiae with individual services simply because we don't have the capacity to do that. But I do want to identify that we have a quite significant resource in terms of our inspection staff, and we are in the process of changing slowly the culture of our organisation, where our inspection staff and all the support staff around that should be facilitating improvement and improvement conversations with the services that they're inspecting. So that's something that we're absolutely involved in and see as the natural next steps for our organisation. But a little bit more about our team. The head of improvement support is Edith McIntosh, and Joyce O'Hare is the manager. And then we have a number of improvement advisors you can see there. And we all have a number of specialty areas, if you like, running from dementia to palliative care to continence and nutrition to early years and GP out of our services. So we contribute a lot to those specific pieces of work in terms of improvement. But whenever there's requests for workshops, which is something that we can support services with, we bring external support in if required around specific content or topic areas. For example, the HSC is a partner who we engage with around leadership and mentoring, etc. So in terms of internal support, and we're talking about for our Care Inspectorate staff here, we'll get on to the external support in a second. We've delivered improvement workshops to all of our inspection teams, including our strategic inspection staff, in order to raise awareness and build confidence to use a specific improvement approach in order to facilitate services to improve. And that should be coming through over the next coming years, and how these conversations are pitched in the language that we're using. We also provide guidance and support and resources on our hub, which will direct you to the website later. We also we'll have this saying in improvement, so what? So we have often been nearly guilty of accepting activities as a form of improvement. People will say, we're doing X, Y, and Z. We have a policy for that. We will put new training in place. We will review our processes. We've been guilty in the past of saying, okay, that sounds like the good way forward. Well, actually now we're wanting people to think to themselves, well, what is the outcome of that particular activity? So we've got our inputs, we've got our process, but then we've got our outcomes, and we want people to start thinking about that outcome focus. And that's one of the key areas that we pick up in our workshops internally. But that's also one of the key areas that we pick up in our workshops when we're talking to external providers and other people out there. It's about, what do we do with any new skills we have? How do we use them? Are they being implemented? And what is the outcome? What is the successes with those, and what are the challenges associated with those? And we're very much of the mantra that you need to, improvement as a contact sport, and you need to participate in this in order to learn more about it and therefore upskill to use it. But like I say, we have provided the workshops internally, but we've also provided the workshops externally, total of around 60 up until this point. We started in September last year, so we've been very busy. We're talking about workshops to partnerships and provider organisations, working with colleagues across the country in order to build a network for improvement so that people are supported to use this back at base. Again, answering that so what question. And again, just kind of touching base on some of those external partners that we'll work with and how we build up those networks. So here is an example of an agenda for a workshop that we've delivered recently in partnership with Renfrew Health and Social Care Council and Scottish Care. This is just to give you an idea of what an improvement workshop would look like. You can see here that there's a number of core elements around improvement approaches and human factors, but you can also see that there's quite specific content around hydration and falls, and we also and GP out of hours, but we also are keen to bring our inspection colleagues along for these workshops to, first of all, build relationships outside of the inspection process, which we are finding is adding excellent value through our evaluations. But second of all, so that stakeholders, internal and external, are hearing the same message at the same time. So we're not doing. So the left hand and the right hand know what they're doing. So we've found that absolutely crucial. So there would be all day events, these workshops running from 10 until 3, and they're absolutely tailored to the request of the people's making the request for this support. In terms of community planning partnerships, this is something where I could foresee that we could support the partnership itself around its stakeholders to deliver a workshop, and then if that then translates back to base for those particular stakeholder groups, then that's something we can look at how we would support those particular stakeholder groups. But again, the emphasis here is on we're a small team and we're focusing this and targeting this at strategic level. So I'm going to just give you a little bit of an insight into what some of the content looks like of the workshops. Just a little flavour, and hopefully that brings it to life a little bit for you. So on this slide, I've made a bit of a statement that the increase in complexity of care means that spray and pray protocols will no longer deliver improvements. And often I'm asked the question, what are spray and pray protocols? Well, what I mean by this is that traditionally, and I don't mean in this particular group that I'm talking to now, but I mean in my experience and across Scotland, traditionally we find that protocols or standard operating procedures or policies are emailed out to vast rafts of staff, and people are expected to kind of pick that up, digest that, and then put that into place. And what happens is whenever your own internal quality assurance or maybe somebody external like the Care Inspectorate or Healthcare Improvement Scotland come in and say, listen, there's a problem or a deficit with your service of this process, and managers look at us and say, well, that's not possible. We have a policy for that. And our message really is that, yes, the policies are absolutely crucial, as are the standard operating procedures, the best practice guidance, absolutely crucial. But it's the delivery and how these things are embedded into practice that is sometimes letting down the implementation and the embedding of this. You may be familiar with if issues occur, the spotlight focuses on that particular issue for a period of time, and all the resources rush under that spotlight, and then the spotlight moves when another issue occurs, and all the resources rush to that spotlight as well, and any improvements that we've made at the initial starting place drop away. And we can see this certainly through our scrutiny work, that we see repeat requirements and recommendations across the country over a number of years. And that's because we haven't been able to achieve sustainability. And some of the reasons for that is because that people don't know why they're doing the things they're doing, and the systems are sometimes letting people down. And the potential solution for that is the model for improvement. So this is the model for improvement. You may well be familiar with this. It's not new by any stretch of the imagination, but this is the approach we in the Care Inspectorate are advocating in order to make improvements. There's a number of reasons why we've selected this particular improvement approach, and I always feel like I'm on the radio when I say this particular bit. Other improvement methodologies are available, but this is the one we have selected. We've selected this because, well, it has a proven track record of delivering results. We can see this being used in numerous highly developed and high-performing organisations and communities across the world, from here in Scotland to America to New Zealand to Australia. So it's a proven track record. I worked for the Scottish Pace and Safety Programme in Healthcare Improvement Scotland, and they've been using this for around 10 years, delivering great improvements in various different fields, from frailty to mental health to hospital mortality rates to infection control, etc., etc. And that demonstrates a further point that this model can be used in multiple settings for multiple different purposes. So it's very flexible. And finally, it is very user-friendly and simple to use. You can see that it consists of 3 core questions and the Plan, Do, Study, Act cycle, or the PDSA cycle that we see at the bottom there. So what I propose very quickly is just to run through the model for improvement and just kind of talk through the 3 questions in the PDSA cycle very briefly. So question 1 in the model for improvement is, what are we trying to accomplish? So I guess if we're trying to make any improvement in anything that we're doing, regardless of your setting or of the area that you work in, it's very important to establish your aim. Often we have found that whenever we are talking to people who want to improve and we say, well, how do you know, or what are you trying to improve? And they kind of do that shrug of the shoulders and go, we just want to make things better around here, or we just want to see smiles on people's faces, or we want things to run a bit more smoothly. And they are aspirational and sound aspirational things they want to achieve. But if we don't set an aim that is, if you think about the SMART criteria being specific, measurable, achievable, realistic, and timely, if we don't set a criteria, or if we don't set, an aim using those criteria, we will find that we can get quite lost and we'll lose our focus. So whenever we're setting an aim, it has to be very tight around that. So it has to be what exactly it is we're trying to improve. When do we want to improve it by? Is this relevant? Is this realistic? And how will we know that we've achieved that? So food for thought. So any improvement that we want to make, we'll have to think about setting our aim. So once we've set our aim, then we have to think about, well, how will we know that this change, this thing that we're doing, has led to an improvement? So this is around measurement. How will we know the impact of the work we're doing? Quite often, again, we find people saying, well, things are generally better around here. They think they've achieved their aspirational aim, or people say that there are more smiles on people's faces, or the process is running a lot smoother. And a lot of this can be anecdotal. But unless we measure it in a precise way, we can't, in all faith and accurately stand over and say that we have made an actual improvement. So absolutely crucial to the approach that we're talking about is taking measurement. But not just an audit or a one-off, how are things going around here. It has to be a measurement over time. It has to be a continual collection of data around a particular, whatever subject area it is that you are trying to improve. And only then can we understand what the norm is within our system, and then whether we're having an impact on that system by the things that we're doing, the improvement activity that we're doing. So measurement is absolutely crucial. And then the final question is, what changes can we make that will result in an improvement? So these are the things that we think will help us achieve our aim. So if I take you back, and I'll use a very quick example. If we want to improve falls in care home or area X by 50% by December 2019, that's our tight aim. Our measurement will be the number of falls. How will we know that we've a change has led to an improvement? Well, we'll measure the number of falls. If they've reduced, then we're making an improvement. If they have stayed the same, then our activity maybe not as having the impact we want it to. And if falls have increased, then maybe the things that we have done have negatively impacted that. And only then will we know. And finally, what changes can we make that will result in an improvement? What things do we think that will improve falls? Well, that could be numerous things. It could be footwear assessments, environmental changes. It could be increase in staff, lighting changes, medication reviews, etc. These are the things that we think will help us achieve our aim. Okay, but we have to test those things out to see whether they're having the impact. And that's when the PDSA, or the Plan, Do, Study, Act cycle comes into play. We take one of those change ideas from question 3 in the model for improvement and we put it into the PDSA cycle. We test it out and we'll know whether it's having an impact because we're taking measurement. But the question you want to ask is, well, why do we need to test it out? Well, it's absolutely crucial that we test things out because there's no one single correct plan that will solve the problem for us. It's usually a combination of multiple things that will help us achieve our aim. So if you want to improve a process and you simply change the paperwork, that may help improve the process, but it maybe won't improve it to the point where we've made waiting times, 70% higher or lower. So there's no single correct plan. So we need to test those things out, and no one person has the power. What I mean by that is we have been guilty in the past of designing solutions to problems that people didn't necessarily know that they had, and then handing it to them and saying, here you go, here's the new way forward, and not necessarily engaging with people on the front line about how they think we should improve the service, and therefore we have little understanding of how things work in the real world. We have, as managers, sometimes an aspirational view that a process runs from step 1 to step 10, but in actual fact, a process can run from step 1, jump to step 4, then to step 8, then to step 3, etc., etc., and it zigzags all over the place. And if we want to implement a change to that process based on our understanding of it, then we'll more than likely fail. But if we have the frontline input about how the process really works in practice, then we have a better chance of creating a solution that will help us achieve our aim. And that's why it's crucial to have as many people involved in the conversation as possible. And again, here I make the point that testing changes allows us a local design of the process. And what I mean by that is something that could work in service A and work absolutely extremely well won't necessarily can be lifted straight off the shelf and dropped into service B and work to the same degree. And that's for numerous different reasons. It could be geographical reasons, it could be leadership, it could be environmental, it could be as simple as language. There's numerous different things that we need to understand within our specific context that to allow us to adopt our approach to be successful. So testing allows local design of the process. How familiar are you with this, where you design something based on your understanding of the process and you implement it, and then you find out that there's immediate workarounds. There's the design, but then there's the user experience. And here you see this gentleman, as we see all over the place, going for the most direct route to get to where he needs to go. And we have a path there designed by the architects with all great intentions that isn't being used. Is it a waste of resources? Is it a waste of planning? Is it a waste of finance? Well, I mean, it could well be. But that's a nice illustration of how workarounds often circumnavigate our understanding of systems. And finally, testing allows us to understand the cost and side effects of any changes that we would like to try. If we did that spray and pray that I talked about earlier and just simply rolled out a policy for whatever, or rolled out a new standard operating procedure for whatever, there may well be unintended consequences associated with that we haven't fully understood when we were conceiving that. If we test at small scale and try it with a small group of stakeholders or a unit or a particular service, we can understand if there are any unintended consequences and then make changes to our plans before we try and roll it out further. And that obviously has a cost implication. So just to kind of start to sum up, this is the old or typical approach of doing things. It certainly was my approach back in the day whenever I was trying to solve problems where you designed something and then you approved it and then you implemented it. Well, the improvement science approach is design, then test it, and continuously test that approach. And I mean, design with the right people in the room, the core stakeholders in the room, and test and test and test, understand all the understand our system, understand how these things play out in the real world, understand any unintended consequences, and then you can get to the point where you can improve this approach as achieving what we want to achieve, and then implement. So just to share some of the evaluations of the work that we have, or some of the workshops that we've delivered up until this point. Well, here we can see a brief evaluation up until April this year. We have delivered extensively more workshops than the data that we have here. But just to give you an understanding, that 93% have said it's increased their understanding of quality improvement, and around 80% says it's increased their confidence to participate in improvement projects. And that's absolutely our core aims, to increase awareness of this approach, but also increase people's confidence, because we want people to leave the workshops and actually take this and try it out back at base. And of course, we can see here around some more data around an increase awareness to the improvement models, and an increased understanding of the PDSA testing approach as well. Here's just some examples of some of the work we're involved in right now. We're working with Dundee City Council around adult support and protection. That came actually as the result of a strategic inspection last year, where a number of deficits were identified, and we're using this approach with them, where we have identified 3 core project teams to test particular changes out at local level to understand what impact they're having, and if we find that they're having a positive impact, then that's something that we intend to scale up and spread, but we're testing at small scale. We're also working with multiple provider organizations across the country around using the model for improvement and testing changes locally around improving outcomes for people. We've got the CAPA program. It's the Care About Physical Activity. It's a national program run by the Care Inspectorate, where we're seeing massive improvements of people's independence, reduction in isolation, and loneliness, and also their ability to engage in activities. Very simple things like go to the leisure centre, participate in gardening, and really just changing people's outlook. We also are doing lots of internal work with our own staff. We are on a journey, it's fair to say, where we want our staff to be upskilled in improvement, to be part of their conversation out there, to change the whole landscape and social care around what improvement is. And we've started our professional development board, where improvement is absolutely a core theme, and we're influencing our methodology internally as well through numerous different transformational projects. So it's fair to say that improvement really is the golden thread in absolutely everything that we do, and we absolutely hope it's something that you will think about as well whenever you're taking the next steps about thinking about your services and how to engage with your partnerships, and whether this would be something that you feel that people will get some added value and benefit from, and that's something we can have a further conversation about. So here, nearly finished with a quote from Einstein. He's saying the definition of insanity is doing the same thing over and over and expecting different results. And how many times have we found ourselves in that position when you say, let's just try the same thing over again and expect something different to happen? Well, we're in a place now where hopefully we'll have access to more resources to do things slightly differently. So where can this approach be used? I think I've covered that already. Absolutely anywhere, and including community planning partnerships. And we absolutely hope that that's something that you would consider looking into a little bit further. There are various resources on the Hub website, the Care Inspectorate Hub website, around who we are, what we do, and some tools that we use. I would encourage you to look at that. You can see our strategy there as well. And I would like to finish by asking if there are any questions, but also leave you my email address. You can drop me an email at any time. And if you want to have a conversation about if there's any requests for a workshop for your particular partnership area, and that's something we can certainly have a conversation about. Thank you very much for your time. And if there's any questions, I'll be happy to look into those.
Thank you very much. So, as you say, if there are any questions now, is a good time to type them in. We didn't get any questions during the webinar, so I have a couple that, I mean, it might be that I'm a novice to this, but so you have an improvement strategy, a new one, and it was for 2 years. The next one is 3 years, but what improvements have you seen between those two since you're working on them, and how have you measured sort of up against yourself?
Absolutely. Yeah, great question. So we'll have quite a comprehensive measurement plan within attached to that strategy, and I was key in bringing some of those elements together. And our key aims were about upskilling individuals around this approach, our range of networks and contacts. So we're talking about how broad we can get with the resources we have. So our evaluation of the workshop, some of the core questions are: do you have increased confidence to use this approach? Has your perception of improvement changed? So that's some of our cultural kind of understanding as well. And internally, we're doing some temperature checks around what the culture of our organisation is around improvement. So we have a number of those kind of cultural things, but we also have that operational side as well. But we're also, if you look at the CAPA program, they have a number of core measurements around increasing physical activity, some of those real step counts, sit to strength, but also the qualitative stuff. And the qualitative stuff is actually as powerful as the quantitative stuff. We have lots of case studies of individuals whose lives have essentially changed as a result of the work that we're doing. And our plan is to continue to gather all this data and do an event in early next year, maybe around March, April time, where we bring a lot of our core stakeholders who have been trying this approach out back at base to come and share their experiences, so everybody can learn from each other. Because if it's new to you, it is a little bit daunting to try something new, but it's only through trying it that it becomes another tool in your toolkit.
Okay. So what are the major changes between the almost old strategy and the new one?
Well, there was no the current strategy.
The current.
Well, so that's that very core question of what next?
Yeah.
And so what? So what? We've delivered all these workshops. So what? That we have upskilled, in the region of 900 odd individuals from all around the country. So what? That our inspection staff have a new understanding of improvement. And they're the key questions that we're starting to ask ourselves now. Okay, so do we now take this to the next level? Do we run more in-depth stuff for our staff? But crucially, we want to see them engaging in improvement activities. So we're doing a digital business transformation piece in the Care Inspectorate just now around what our staff actually do around improvement. So it's gathering that information. Do we want to set ourselves a target of 70% of inspections have an improvement conversation as part of that? 80% of inspections have an action plan that uses our improvement methodology. So those are the kind of questions that we're asking ourselves, and it's very much that journey, isn't it? If we jumped in here 2 feet first and say we want to reach for the stars too early, we'll be putting too many people off, and we wouldn't reach the audience we want to reach. So yeah, those are the kind of things we're thinking about just now.
So when you started out, obviously the improvement strategy came out in 2017, but there must have been something that triggered that you were able to implement an improvement strategy. And so how did you get to that position? Because I believe there are probably many organizations that they want to improve, but how do you sort of implement a culture where where it's a constant focus on improvement.
Yeah. So, I mean, we have a legislative requirement as a scrutiny and improvement organisation. So, first and foremost, we're a scrutiny organisation that does improvement. My previous organisation was Healthcare Improvement Scotland. They're an improvement organisation that does scrutiny. So, we in the Care Inspectorate have that legislative requirement, and that's translated into the formation of the improvement support team, which is a core team that is their focus. We have excellent leadership through Edith McIntosh and Joyce O'Hare, who are really driving forward this strategy, setting out our key targets, for the next year or so from here on in, and they've really started to set out the stall now for what our organisation should be doing. We've got a number of improvement advisors in post. We've 2 more coming on board for specific pieces of work and to support the strategy, and that is continuing to grow, and we're developing resources and garnering support from kind of all aspects of health and social care in order to just really bolster what us as an organisation are doing. So yeah, there's work to be done, and we're on a journey. But from the short time that we've been doing this, we're very pleased with the amount of impact we've been able to make.
Great, thanks. I'm not getting any questions here, so I'll just continue with a few more, and then if no more come in, we'll finish. Thank you so far. So what are the main challenges you've come across in developing an improvement culture?
So I think it's fair to say that the social care world is slightly new to improvement, to this particular strand or approach to improvement. As an organisation, we have improvement or scrutiny absolutely does lead to improvement, but there's different strands, and this approach that we're talking about here is different. So we have to change people's hearts and minds around that. There's the old school that are taking this on, not necessarily on board. They've always been participating in improvement, but this is just a slightly different way of doing that. So it's about changing mindsets and demonstrating the impact of the work that the outcomes of this work is really the starting point. And the improvement alliances that we're building with Healthcare Improvement Scotland, with the HSC, with NES, various others, to kind of it's that groundswell, isn't it? It's that snowball, and it's a mindset. And that's really where we've been focusing our approach. We have the big bang stuff, which is the CAPA national program, and then we have and that's the kind of the national level stuff. But we'll have the bottom up stuff as well. We're supporting services locally to participate in improvement. So we're trying to meet this in the middle. But it is a challenge in terms of the size of the team and the mindset, and trying to spread ourselves as far and wide as we can without overcommitting, because if we get bogged down with supporting particular area with a lot of our time and resource, then there's gaps in our strategy and our approach to doing that.
So yeah, I think the final one is, setting measurable outcomes is something we come across at a long time, but cultural changes are very hard to measure. It's often long term. So how have you managed within your own organization to set smart targets that are cultural based?
Well, that's it. It's extremely difficult to do that and to demonstrate that change in a short period of time. So what we've committed to doing is an ongoing temperature check within our organisation about what is your understanding of improvement, what is your use of improvement, and the same key questions we're going out to all our staff. We'll have an extremely high response rate to all our staff, and we continue to check that over the course of this strategy and the next, and we take that temperature check every year, and that's one of the core ways of doing that. But we also have got a number of anecdotal bits of evidence. We are supporting our staff not just through the workshops, but through improvement surgeries or drop-ins. We've delivered 8 of those or supported 8 of those up until this point, where staff are coming to us and saying, I'm going out to visit this service, or I'm talking to this partnership. Can you give me some more support around how this message. I'm going to query some of their ways that they're doing things. How does that feel, and what should my next steps be? So we'll have all those, and we promote those on our hub as well, so people can see what the inspection staff are getting up to. But we also capture that through our own internal processes, our inspection reporting tool, or and things like that, where they say, how much time have you spent improvement with this service in the last year? And we're asking them to record that, but not just record that, be specific about what type of improvement they've been involved in with that service. So that's that so what question, isn't it? Okay, you've had this new skill potentially. How are you using that? And these are the various different ways that we're capturing those bits of information.
So doesn't it take a lot of time from people's real work?
The improvement stuff, that is one of the core challenges. Absolutely. So we are trying to influence the conversation internally about what is the role of inspectors, and not just inspectors, but what is the role of the support staff around the inspection. We have a support or inspection assistants and inspection associates, and what role do they have to play in that? But it's not just our internal group of staff that we're talking about here. It's the people out there in service as well. We've got services managers, we've got strategic planners, we've got various different people in commissioning, and they're saying, well, we want to improve our approach here, we want to improve the outcome, we want to improve XYZ, and where do they get the time? So need to have some sort of ownership and buy-in from leaders to support this. And having this framework or this structure for the model of improvement really supports that. And crucially around collecting the data and saying, these are things we didn't know about ourselves before because we've collected this information. And see all the other things that we're collecting that we do nothing with, all the other time-consuming paper trails that we do absolutely nothing with. Why are we doing that if we're doing nothing with that information? So actually there can be a balance there as well, and say, can we stop doing this to do a little bit more of that? And this is data for improvement rather than data for data's sake.
Thank you very much. I don't seem to be getting any questions, so either I'm asking really good questions or we have lost people on the other side. I don't think so, but I'd like to thank you very much for giving this presentation.
Welcome.
As I said earlier, we're going to share it on the Knowledge Hub, the community planning support network on the Knowledge Hub. I will send out an email to delegates after this with links to that, and we will also share the recording, the presentation here. And if there are any further questions that you didn't dare asking now, then you're welcome to ask it in the Knowledge Hub group. We are going to host more webinars onwards in this series. The next one is planned for the end of November, 30th of November, I believe, in the afternoon, where we are going to hear about the relationship between planning, community planning, and improving outcomes in poverty, health, and other areas where we should all be collaborating. Thank you very much. Do you have anything you want to say?
No, not at all. If anybody wants to get in contact, my email's just there. Just drop me a line and we'll pick it up from there. Thank you very much.
And thank you all for attending. I'm going to end the webinar now. So thank you, Aidan, and thank you all.